Hey guys, Dr. Stephanie here. And if you've ever had pain in the side of your knee, you're not alone. Tons of people have pain in the side of their knee, and it seems like it's hard to get rid of for most people. You may have tried a few exercises, may have tried stretching, you may have tried a lot of foam rolling, but nothing really seems to help. I'm going to give you 6 exercises that can help get rid of that pain in the side of your knee for good and get you back to doing all of your favorite activities. So pain in the side of your knee can have different causes. One of the main causes is IT band syndrome. And IT band syndrome is the iliotibial band, which is a band of tissue that runs from the hip, the side of the hip, down the side of the leg, crosses the knee joint, and attaches below. A lot of times, if certain muscles are weak in your hip or certain muscles are tight in your upper leg or hip, that leads to this band rubbing over the side of the knee, rubbing over a bone right there, every time you bend and straighten your knee. So just think about how many times you bend and straighten your knee during the day. It's a lot. So if that tissue, that fascia, is rubbing every time you take a step, that's going to cause inflammation and irritation and pain. Now, there are some other causes of lateral knee pain, and it could be arthritis. You might have some arthritis in the joint. It may be a meniscus tear. There's a ligament on the side, the LCL, lateral collateral ligament. You may have an injury to that. But all of these exercises will help all of those things because generally the pain is in that area. So what we want to do is we want to work on strengthening the glutes, the hips, because these muscles are going to be the stabilizers for your pelvis and hips and lower back and knees. So the stronger they are, the less stress is placed on your knee here, and the less that band will rub on the side, and the less stress will be put on your joint as well. So we really want to focus on strengthening those. I know a lot of people have heard foam rolling is good, but the IT band doesn't stretch. So it's just fascia and it doesn't stretch at all. And a lot of times when you foam roll over it, if it's already irritated, that's just going to create more irritation and more pain, and it may not fix the problem. In fact, it may make it worse, at least for a temporary time. So we don't want to, if it feels good to you, go ahead and do it. But if it feels like it's not helping, I would skip it and go straight to these exercises I'm going to show you. So all you need is, we're going to use a band, so a loop resistance band here. We're going to use a kettlebell. If you don't have a kettlebell, grab a weight. Also a ball. If you don't have a little ball, Pilates ball, a playground ball, you can grab a pillow or roll up a towel. We're just doing one exercise with it, and I'll show you what we're doing. So grab the band first and place this band around your ankles. So what you're going to do here is bend one knee and take the other leg, and you're going to tap in front of you, make a big circle, and tap behind you, and then come back. So keep that foot off the ground the whole time. And you may think, we're actually working both hips, but you may think it's more the hip of the leg that's moving, but it's actually the one that we're standing on. So we're working on the stability on that leg because you have to stabilize in order to keep this one moving. So we're really focusing on strength and stability in this leg, work some balance as well. But it's definitely worth it to do this exercise on both legs, even if you only have pain in one knee. So you want to do about 20 to 25, and you can take breaks. If you can do 20 in a row, then it's probably too easy. So I would do 2 to 3 sets of 10. And say, I know I said 25, so you could do 2 sets of 10 and 1 set of 5. If you feel like you can do 10 for that one, do 10. So do 20, between 20 and 30 reps. And then same thing on the other side, making sure you're keeping this knee bent slightly, this leg in line, and then you're just going to rotate around like this, just back and forth, 2 to 3 sets of 10. Okay, then we're going to move this band up above our knees here, and we're going to do a split squat. So you want to place your feet one in front of the other. Make sure they're shoulder width apart, so you don't want to be in line. You want them to be shoulder width apart. And from here, we're going to do a split squat with this band. So we're just going to squat down and come back up. Try to keep the front knee in line. And I know some people think it's not okay to put your knee over your toe, but research has proven that that's okay. So go ahead and let that knee go over your toe. It's something we do in daily life. So it's important that you learn to do that without pain. So you're just going to squat down and come back up. If this feels too easy or you want to add an extra challenge, go ahead and grab a weight in each hand. And you want to do 2 to 3 sets of 10. And then flip to the other side and same thing. 2 to 3 sets of 10. Here. Just going down as low as you can go. If you can't go that low to start out with, that's okay. Just do a little, kind of a mini squat here. But this is working on hip stability, glute strength. The band helps because when the band is here, it's forcing you to pull your hip out and keep your knee straight over your foot. Because if the band wasn't there, then you'd have a tendency to pull your knee in, and this just adds a little extra strengthening to that hip joint. Okay, so now keep this band here. We're going to do one more with the band. Grab onto your ball or pillow or rolled up towel. This is going to be against the wall. So you want the ball to be about knee height because you're going to push that ball into the wall as you do this exercise. Place the other foot out a little bit, not too far out. And what we're going to do here is we're just going to rotate our knee out to the side. So just as far out as you can comfortably. Keep those feet straight. You're just going to rotate that knee. So I'll show you from the front. So this ball is against the wall, feet shoulder width apart. You're pushing this ball into the wall with that knee. The other knee, you're just rotating the knee out. Kind of keeping the foot on the ground, but rotating the knee out. This is working on some hip and glute strength here. So again, about 2 to 3 sets of 10 on each side. And then we will take the band off and grab on to our weight here. If you don't have a kettlebell, just use a regular dumbbell. This is going to be a single leg RDL or a deadlift. So you're going to stand on one leg and grab onto the kettlebell or the weight with both hands. What you're going to do is, so in RDL, you're going to keep your back pretty flat, keep your knee bent, go straight down, come back up. But we're going to add a little twist to make it a little more challenging. We're going to twist to the inside here and then come back up. So twist to the inside and come back up. So this is really working on that glute strength. You want to go nice and slow, working on balance as well. If you find that hard to do, you can place the back toe on the ground and do that as well. So just down and back up, down and back up. I would say probably 15 or 20 on each side. Okay, then let's actually grab the band again. So place this around your ankles. And what we're going to do here is knees slightly bent. You're going to take a wide step, keeping your feet straight, and then bring the knee up towards your chest. Wide step, knee up towards your chest. Wide step, knee up. Wide step, knee up. If you find it hard, I know the band tends to roll around your ankles. You can also place the band around your knees here and just take a wide step and knee up. That makes the band stay a little bit better. The other way is a little more difficult. So maybe start out this way and then you can place it around your ankles. This one I would do for about a minute and then repeat that 2 to 3 times. Just back and forth, making sure those feet stay straight, really working on that glute strength and single leg stability. Okay, last one we're going to do is we're actually going to get down on the floor and lie on our back. So this one, we're going to do a bridge, and then from here, we're going to do a march, and then a march and out and back in. March, out, back in. So march, march and out and back in. March and out and back in. So just making a bridge a little bit more difficult. March out, march out. That one I would do about 10 or 15 on each side. If you feel like at some point you're not doing the form correctly, then that's probably where you should stop for the day, and then you can gradually keep working on it and start building more strength. But all of those will help build hip strength and stability and help get rid of that lateral knee pain that you're feeling.